All right, fantastic. And I think we will get started. Hold on one second. Beautiful. All right, everybody, welcome to today's Lunch and Learn on postpartum recovery. My name is Kristen Wilson, and I'm co-owner and physical therapist at Action Potential. This is a topic that I hold near and dear to my heart, having had 3 boys of my own, now 11, 9, and 6. I firsthand understand how difficult the postpartum recovery can be, both from a physical perspective and an adjustment perspective of getting used to, life with a new baby or multiple babies or whatever the case may be. So I'm really excited to be here today to discuss this really important topic, especially because not only does it meet my needs personally, but because this is something that a lot of people don't have a lot of guidance in. And one of our jobs as a profession in physical therapy is to start to educate our OBs about the importance of this topic, since so many women are delivering babies and not really understanding where to even start with regaining full control of their body after all that havoc has been wreaked. So certainly looking forward to today's presentation. I will say, as we are going through the presentation, if those of you who are joining us on Zoom want to post questions into the chat box, that's more than great, because I will address those as we go through. And certainly if you're watching on Facebook and want to comment within the Facebook Live broadcast, Nina can feed those through to me on Zoom and we can address those that way. If you do post a question that isn't answered live, I will certainly reach back out to you via Facebook message to make sure that you get the answers to those questions. So as we talk about this topic, we're going to cover a couple different aspects of that postpartum recovery. So first, we'll just generally talk about the physical effects of pregnancy on the body, as well as delivery on the body, and what you can expect from that entire process, and how that's going to affect your muscles, how that's going to affect your ligaments, how that's going to affect your skin, and all of the other physical ramifications of carrying that watermelon for 9 months. We'll also talk about some scar management techniques. So certainly for those of you out there that have had cesarean or maybe an episiotomy or a tear, that will leave a scar on your body, and we'll talk about how to manage that to both mitigate the painful effects of that as well as the cosmetic effects of that. I'm going to spend some time highlighting some exercises to improve your pelvic floor and hip strength, and kind of what my recommendation is for the progression through those exercises. And then we'll talk about some safe procedures for returning to running. I will caveat that both now and when we get to that topic later, that progressing to running can be a very, very individualized approach. So these will be some general guidelines that will help to give some construct to that process. However, that will be something that you'll want to discuss with a practitioner about the safe regimen for returning. And then lastly, we'll just talk about some safe lifting recommendations, as well as some strategies for nursing or feeding to help prevent pain both in the back as well as in the neck. Because oftentimes postpartum, the 2 main reasons that I end up seeing somebody in the clinic is, one, they're incredibly well educated and understand the role of pelvic floor, and they want to have a pelvic floor assessment, or 2, they end up having pain in the neck or the back because of lifting that baby all the time, or bending over and nursing or feeding in an improper way. So we'll talk about some strategies for helping to mitigate those problems and prevent you from having that pain down the road. So let's start first by talking a little bit here about the effects of pregnancy on the body, as well as childbirth. And as you can imagine, having gone through this process probably yourself, you've had experienced firsthand the grotesque trauma that occurs in the nether regions and in your abdomen as a result of growing a baby within your stomach. And so really, this slide here is meant to just kind of summarize some of those changes. And certainly for each person, it's going to be a very individualized process. But some of the general themes that we see in regards to the effects on the body are a result of these common issues. So the first is that we see an alteration in the hormones throughout the pregnancy as well as postpartum if you continue to nurse or breastfeed. This leads to a reduction in the integrity of the ligaments of the body. So, most people are familiar with the fact that as you become pregnant and throughout your pregnancy, your ligaments tend to stretch as a result of a hormone called relaxin. And that relaxin actually allows, like it sounds, those ligaments to relax and stretch to accommodate for the weight and size of that fetus within the uterus. It also allows the pelvis to expand to allow that baby to exit through childbirth. You can imagine as those supporting structures or ligaments are stretched, it can lead to an increase in flexibility and an increase in motion within some structures that typically aren't meant to move very much. So most people will feel this in two spots, and that's one at the pubic symphysis, which is right where your pelvic bone meets in the middle. And it's located right at the base of your zipper of your pants. So if I were to show you on myself, the pubic symphysis is located right here, just above the labial lips and the vagina. And usually people will have pain if they have too much stretching through that structure in the front part of their pelvis. The other key spot where people will have pain during pregnancy as a result of overstretching and flexibility is in the SI joint or sacroiliac joint. And those joints are located in the back, just at the base of the spine. And these are the joints where the two pelvic bones meet with the base of the spine, which is a triangular bone called the sacrum. Those joints are typically covered in very thick ligamentous structures that provide stability to allow weight to be transferred between the legs as well as up the kinetic chain. So when we see that flexibility in those joints, it can actually cause pinching pain and pain down into the leg as a result of that bone joint moving more than it should. This can also cause the muscles around the hip girdle to tighten and spasm, which can also cause pain down the leg, or what most people commonly call sciatica. So certainly we see that change in the ligamentous structures can lead to a variety of different conditions related to pain, but can also just cause a general sense of instability within the entire pelvis and spine. Certainly as the baby is growing within the uterus, it takes up a lot of real estate within the abdomen. I love this photo on the right of the baby in your utero, because you really get a perspective for how much that baby's presence distends the musculature of the abdomen. The most common symptom or diagnosis that most of my postpartum moms have heard of is known as diastasis rectus. And this is when there's a separation between the muscle, the long muscle of the abdomen, called the rectus abdominis. And this is typically the 6-pack muscle or 8-pack muscle that comes down the front of the abdomen. That muscle is joined at the middle by a very thick tendon, and as the baby grows, it can actually cause a separation at that tendon, which typically happens right at the umbilicus or belly button. And that separation pulls apart and leads to an instability of the abdominal wall. Postpartum, most people will see this. I remember postpartum seeing it most when I was laying in bed and I'd go to sit up, and you get like this little, I call it the cone head Sunday. You get a little point at your stomach that looks like a little cone head popping through. That is evidence that you have a potential for a diastasis rectus or a separation in those abdominal muscles. So that's usually my at-home test that I'll tell moms about is, lay on your back, lift your head up off of the bed, or your shoulders up like you're doing a little tiny crunch, and see if you get the cone head Sunday on your stomach. And if you do, that's usually evidence that you've had some separation of the rectus abdominis muscle, or that the muscle below the rectus abdominis, known as the transverse abdominis, may have lost some of its muscle tension. And this is very, very common as a result of that baby growing within the abdomen. That transverse abdominis muscle, it wraps around your body like a girdle, and it provides the integrity to the midsection of the body, which helps to not only give you your waistline back and flatten your stomach, but it also provides necessary support to the spine and the rest of the pelvis and hips. So that transverse abdominis is a really critical muscle as part of the recovery from postpartum. The last piece I'll mention about that transverse abdominis, because it tends to be one of my favorite muscles, is that it works in conjunction with the pelvic floor. So if you see on that second picture there, I have the bony alignment of the pelvis, and you see all those muscles that are pink going down between those two bones. That's your pelvic floor, which acts as a hammock. The hammock provides the bottom of your core or your midsection. Your diaphragm creates the top section of your core, and the transverse abdominis creates the sides of the core. Those muscles coupled together make your core like a little can or a canister. And as we recover postpartum, our job is to build the integrity of that canister to allow your spine and your pelvis to do the things that are necessary. So that transverse abdominis, when it becomes very overstretched, it loses its ability to communicate with the pelvic floor, which we'll talk about in just a minute. The other thing to note is if you have had a cesarean section, the doctor had to cut through the layer of all of those abdominal muscles, particularly the transverse abdominis, in order to have access to the uterus to remove the baby. As a result of slicing through that muscle, oftentimes the muscle kind of turns off or inhibits itself because it's more or less saying, hey, boy, you just cut right through me. That kind of hurts. I don't want to use it anymore. So the muscle kind of loses its ability to turn on correctly. So one of the things we do in physical therapy is we teach that muscle how to turn on so that it's able to support and start to build its tension again. As you can imagine, the weight of that fetus sitting along that hammock of the pelvic floor over time is going to cause that pelvic floor to stretch. It's very synonymous to imagining you have a piece of fabric drawn taut and you put a really heavy watermelon on it and leave it there for 9 months. Over time, that fabric is going to stretch and you're going to start to see some bowing as those fabric fibers start to pull apart. The same thing is similar in the pelvic floor. The muscles begin to stretch almost to a point of overstretching, and the pelvis widens because of the changes in the ligaments. And the combination of those two things take those pelvic floor muscles and make them less efficient. Certainly, you can imagine as that baby exits through the vaginal opening during delivery, that's going to take your little tiny vagina and really overstretch it. So I always joke about, passing a watermelon through a tiny little watering hose. So in that bottom picture, you see the two openings there of the vagina and anus. And you can imagine as that baby passes through that vaginal opening, that ring structure around it, or that circular pink part, that muscle really gets overstretched. And as a result, loses its ability to contract, which is necessary for preventing things like peeing your pants or having leakage during a sneeze or a cough. So, you can imagine those muscles become overstretched and we have to teach them how to contract so that they can regain some of their tension. Last two, we talked a little bit about scarring already, which we will cover on the next slide, which is whether that scarring is occurring in your abdomen as a result of a cesarean section or within your vaginal opening as a result of either a episiotomy or a tear. Certainly that's going to be something we'll need to address, which we'll talk about next. But lastly, I want to just highlight 3 conditions that result from the force of pushing or attempting to push that baby through the vaginal canal. And that could be one condition called a prolapse, which is where the wall of the vagina weakens and either a portion of the bladder or the rectum, the cervix, or the uterus could actually drop down into the vaginal opening. This is very common postpartum. Typically, women who have had multiple children will have a minor prolapse postpartum that can tend to stick around for years and even permanently. The thing to note is that if that prolapse is so severe that it's actually, you can feel it coming down out of the vagina or like a bulging sensation in the vagina, that would warrant having that addressed, because over time it can continue to descend down the vaginal opening and actually protrude out of the body. So certainly that's a very worst case scenario, but one of the things I like to educate my new moms about is to be aware that you may feel that sensation, and that would be an indication that you need some pelvic floor training. Hematoma, this can occur as a result of the pressure of the baby pressing out. It can cause that bruising or almost like blood vessel breaking within the opening of the vagina. Typically, this will resolve in about a week or two, and usually has no long-term effects. Varicose veins occur the same way, just like in your legs. If you spend a lot of time standing, the veins can start to break down and bulge. Same thing occurs in the vagina as a result of that prolonged pushing through the vaginal opening. Varicose veins can be very uncomfortable, and if they last for a long period of time postpartum, there are some certain procedures that your OBGYN could perform to help reduce some of that discomfort. Oftentimes, like a hematoma, this will resolve after a couple weeks postpartum, especially with the help of a Kegel exercise to help remove some of that extra blood from the vaginal area. So, certainly, as you can imagine, lots going on. I love these photos because I think it really kind of pulls into your mind what to expect and how those structures are affected. Okay, scar management. So whether you are newly postpartum or many years postpartum, I have often seen the effects of either poor scar management or lack of scar management. And it's really just because most people don't know that this is something that they should be participating in. So the photo that I have here, I love, because this is typically what I'll see in the clinic is someone will come in or a friend will come up to me and say, hey, I know you do pelvic floor and you work with this. I have this little pooch that goes above my cesarean scar. What the heck do I do to get rid of this? Because it doesn't look good when I'm in a bathing suit. That little pooch is really the scar sticking to the under surface or the under tissues, and almost like a little spider web, that scar ends up sticking to the surfaces below it, and the skin kind of folds over the scar. Oftentimes, if you start a good scar massage program, and again, whether it's a couple of weeks postpartum or years postpartum, you can start to break up that scar tissue and that spider web to allow the tissue to move more freely, which in turn will eliminate that little pooch over the top. So certainly, if unaddressed, this can be more of a cosmetic issue than a pain issue in the abdomen, but I have heard of several patients that end up having almost like a tightness within the abdomen as a result of that scar tissue binding to the surfaces underneath. The other version of the scar, which occurs at the vaginal opening, usually comes as a result of either an episiotomy, where the doctor cut through the tissue, or a tear that resulted from the vagina stretching too far too fast. If you experienced any of those, oftentimes as the skin either heals or is stitched back together, it can actually form a small scar at the opening of the vagina. And oftentimes you can feel this if you insert your finger into the vagina, and you can almost feel the little bit of rough rigidness at the opening of your vagina. This can lead, if left unaddressed, potentially to pain with sex when you first insert the penis or finger or whatever it is into the vaginal vault. And this happens because that spider web now has bound down to all the surfaces of the vagina and doesn't allow the vagina to expand around whatever the object is. So this can be very, very painful over time. I've also had several patients who report that they're not able to use a tampon or have an internal vaginal exam with an OBGYN because it's just so darn painful to have that object inserted. So certainly, if you are having vaginal pain as a result of your scar immobility or potential other muscle spasm issues, that would certainly be a sign that you need to see a pelvic floor therapist to help teach you how to relieve some of that pressure and some of that tightness. To do this yourself, which is very easy to do, you want to imagine, and I'm going to use my arm as an example. And actually, look, I'll use my bracelet. There's your scar right there on your abdomen. Okay, here's your belly button. Here are your legs coming down. Here's your cesarean scar. What you're going to want to do is you're going to put your finger on the scar and you're going to press gently in towards the surface so that you're just putting a little bit of pressure into the skin. Once you apply that pressure, you're going to then move the skin in all directions. So I usually tell people start with up and down, then you're going to go side to side, and then you're going to do circles, both counterclockwise and clockwise. And as you can see here on my arm, my skin is really pliable and is moving in all different directions. That's what you're looking for when you do the scar massage. Typically, when you do a cesarean scar massage, what you're going to find is that the tissue is going to be like kind of stuck and it doesn't want to move in a couple different directions. When you find that direction, just work it a little bit by pressing down against it. You're trying to improve the ability of that skin to eventually be very pliable and move in all directions. That it should not be painful at all. And typically people will just think of it more as like a little gentle tugging at the surface of the scar. I do want to caveat the cesarean as well as vaginal scar massage by saying that you definitely cannot start the scar massage until the scar is fully healed. So that means no opening along the scar, no pain with touching, and it should be fully sealed shut. Oftentimes, I usually recommend until after the 6-week follow-up appointment before starting the scar massage. This gives the scar ample time to heal. It reduces the sensitivity, but then it also allows you to get in there early to start to massage that scar to prevent any kind of spider web formation from happening. If you are going to do a vaginal massage or introital massage to help alleviate some of the pressure there, it's a very similar principle. You're going to insert your finger or an object like a tampon applicator, or if you have a dilator or a vibrator, you can use that into the vaginal vault. You're going to find the area that's sore, and then you're just going to rock back and forth. So if I was going right in this way, I'd go back and forth along the surface of that scar, and again, move it back and forth, up and down, and circular in different directions. Certainly, I understand this can be a little bit difficult to do to yourself. So the other option is to have a partner perform that for you, where you can then guide them through the pressure as well as the sensitivity. If you have some hesitation about performing this yourself, certainly then I would recommend seeing a pelvic floor specialist who can help teach you hands-on how to do that scar massage. But the long story short is adequate and early scar management will prevent lots of problems down the road, whether it's cosmetic or functional problems. So certainly if you have questions about that, be sure to reach out because this is something that is very easily preventable. Okay, the meat and potatoes. Everybody wants to know, okay, how can I get my body back? How can I exercise? How can I restore my normal program or restore my body to where I feel confident that I'm able to do tasks without hurting myself? So this is a very loose guideline on some principles for progressing through exercise postpartum. I want to spend some time highlighting each of the different areas. However, mentioning that for each person, it's going to be very individualized depending on the type of labor they had, the size of the baby, any complications they might have had, how long they pushed. So there's a variety of different conditions that are going to change this recommendation for each person. So please keep in mind as you go through this slide and this presentation that if you have specific questions, your best bet is to see a specialist to help answer those questions. And I'm happy to answer those questions via email as well. So please reach out. So the first exercise, and this is the one that certainly people have heard about, but 99% of people do incorrectly, and that is the Kegel. So the Kegel is a pelvic floor exercise that works on tightening and restoring the tension of that hammock in the pelvis. So we know that that hammock provides the support necessary to support your organs, but it also provides the support necessary for your pelvis and your hip to work like it should. So my way to teach a Kegel is a little bit maybe atypical, but I'm going to take you guys through the process of how I instruct a Kegel because I feel that the visualization really helps in understanding how to perform this. I do not recommend the Kegel technique of stopping your flow of urine while you're in the middle of peeing, because I find that not only is ineffective in teaching people the correct motion, but it also can put you at risk for things like a UTI. So I typically will not utilize that cue when teaching a Kegel exercise. So the way that I teach a Kegel is I ask my patients to lay on their back with their knees bent in what's called a hook lying position. Your other alternative is you can put your legs down flat, or you can put the soles of your feet together and open up like a butterfly. The idea is that you really want your lower body to be really relaxed in that position. As you're laying there, you're going to take a nice breath in, and as you exhale, you're going to imagine that out of your vagina is blossoming a huge flower with many petals. So I always like to picture a peony because I think they're beautiful and they just have tons of petals and they're just big and hanging out. So I want you to imagine that out of your vagina is a humongous peony. As you exhale, you're going to imagine pulling each of those petals in to your vagina. So you're lifting and pulling those petals in and tightening around the vaginal opening. So the two cues I use are pull the petals in, and then at the opening of your vagina, imagine that it's two elevator doors that you're going to close and cinch shut. So it's like you're pulling the petals in, closing the doors to keep the petals inside. Okay, so this is my best effort at a visualization for a Kegel. One way that you can test your Kegel effectiveness is you can either, well, I should say two ways. You can either stick a finger in your vagina and see if you feel the vagina actually close around your finger, or you can put your two fingers on either side of your hip points. So you find your hip points, come just inside towards your belly button, so you're halfway between your belly button and your hip points. And as you do your Kegel, you should feel that muscle create some tension. So that's another way that you can determine, lost my stool, that you can determine if your Kegel is turning on. That muscle that you're feeling there is the transverse abdominis, or that girdle muscle. So it really shows how well those two muscles fire together. When performing a Kegel, I typically recommend two types of a Kegel early on postpartum. The first is a contraction with a hold, or pulling the pedals in and holding it for as long as you can. Usually postpartum, that's going to be about 2-3 seconds, and then you're going to relax, and you may not even be able to hold it that long, and that's okay. But you're going to start with that little bit of hold and then relax and repeat. Okay, and you're holding as long as you can. Over time, you're going to try to build up that hold to where you can hold for about 10 seconds. Now, I will tell you, that is incredibly difficult to do postpartum. So you're going to gradually increase that hold time to maybe 5 seconds, 7 seconds, and then going to 10, so that you can start to build the endurance of that pelvic floor. The other type of Kegel that I use is called quick flicks. This is where you turn on the pelvic floor and turn it off, or Kegel and then let go. Kegel and then let go, Kegel and let go. I liken this to turning on a light switch, turning off a light switch. So for this one, what I would recommend is laying down. You're going to pull the pedals in, let the pedals go. Pull the pedals in, let the pedals go. Pull them in, let them go. So you're doing this so that you feel a full contraction and a full relaxation, but the goal is to try to do those repetitively as fast as possible, making sure that you're definitely getting a full relaxation between each contraction. So the beauty of the Kegel is, one, you can start this immediately postpartum. Baby comes out, 2 hours later, you're sitting there in the bed, hanging out, or in the chair, resting, do a couple Kegels. This is going to help you start to build that tension of the pelvic floor, as well as reinforce that signal to the muscle to say, hey, listen, it's okay for you to work now. After that vagina has been stretched out, it's like, ooh, I'm tired. I don't want to do anything. You're saying to it, listen, buddy bear, get back on the horse, because we've got a job to do. So you can start this immediately postpartum. If you've had complications, then you're certainly going to want to ask your physician, whomever is there post-delivery. But this is a really nice exercise that you can start as soon as possible to help build that integrity of the pelvic floor. There's really no harm to starting to get that pelvic floor active. The other beauty of a Kegel is nobody knows you're doing it. So where it says how much and it says throughout the day, you can do this exercise repeatedly throughout the day, and it's not really a big deal. So, if you can feel that sensation sitting, you can do your Kegel while you're at a red light, or maybe you're nursing the baby, or maybe you're talking to your mother-in-law and you're thinking, boy, I could be doing a Kegel right now. So, you can certainly implement this in as much as you can throughout the day to, again, reinforce the integrity of the muscle or increase that sensitivity. So repeating this throughout the day is going to really help to build that tension. Okay, the second exercise that I like to introduce very early on is the idea of activating that transverse abdominis. Now, please keep in mind, I do not mean doing crunches. So we really want to avoid the desire or the tendency to want to do the sit-up or crunches exercise early on postpartum, because what happens is that transverse abdominis isn't ready to support the body, and we get that conehead Sunday bulge. And as we reinforce that conehead Sunday bulge, it further breaks down the integrity of the abdominal muscles. So we're going to really want to emphasize activating the correct abdominal muscle, and in this case, that's going to be the transverse abdominis. So 2 cues that I will use to teach people how to turn this muscle on. Again, easiest position would be laying down. You're going to put your fingers on your 2 hip points like we did when we were testing the Kegel, but this time imagine, actually, you know what, go just inside like we did for the Kegel. So you're going to go right inside the hip points between the belly button and the bones, and you're going to imagine that you're going to take those 2 hip points and pull them together. So if I were to demonstrate that here, it would essentially be like these 2 hip points pulling together this way. The visualization of that is going to create tension in your muscle. So the other cue that I'll use is imagine that you're getting a karate chop to your stomach and you're going to try to prevent that from being painful. So you're creating that tension by drawing those hip points together. Bear in mind, this is very different than cinching your muscles or puffing out your stomach and clenching. I want you to think more about a gentle tension of allowing that muscle to turn on. Once you feel that sensation, then you can add in a little bit of a challenge to the abdomen by adding in some marching or some lower extremity challenges. And I'll show you that right now. So in that exercise, you would lay down, you would have your fingers just inside the hip points, create your tension, and then you're going to just add a little bit of a march on each side. As you're doing this, you're checking to see, do I see a lot of motion in my hips where they're moving all over, or am I able to keep that nice and still? If you're able to keep it still, you could also try bringing both legs up and maintaining that tension as well as maintaining your breathing. So the important thing here is that you're not holding your breath, and you're able to maintain steady breathing as you lift one or both legs off the surface. The counter position to performing the task I just showed is a plank. So a plank is nice because it's, again, the body stays in a nice erect position, so we don't have any crunching. But we can go into that nice plank position and feel that sensation of tightening through the middle. And in a plank, if you wanted to make that a little bit harder, you could add in taking one hand and touching the opposite shoulder. So again, no motion happening in the hips, everything should be really still, but I'm creating that tension first in my normal plank, and then adding a little bit of a challenge by tapping side to side. And what that does is it helps to turn on that transverse abdominis muscle so that it fires appropriately. Just like the Kegel, you can start that early sensation of pointing the hip bones together or doing the gentle marching as soon as you feel that you're able to feel the sensation of your stomach. So if you've had a cesarean, that may be a couple days after the cesarean where you start to feel the sensation again of your stomach. But certainly this isn't one that we can implement easily because it's not going to add any stress to additional structures. There are several ways that we can progress the challenge of abdominal challenges safely, and that would be a great conversation to have with a skilled practitioner to help guide you through that process. So we've covered the Kegel or pelvic floor. We've covered the abdomen. Let's talk a little bit about the hip girdle and the hips. The reason I'm so passionate about the hip girdle is that, the hip girdle is what's going to translate force from the ground up into the body. It's kind of the connector piece into the pelvis and the spine. And having adequate hip strength and stability is what's going to allow you to progress to more dynamic tasks like running, body pump, hiking, whatever the case may be, wherever your goals are. This ability to do that is going to rely on your hip strength and your pelvic stability. So as we recover postpartum, you're going to want to start that process by doing two-footed tasks first, where the load is equally distributed between both sides of the pelvis. As your strength progresses, then we can go to one-legged tasks, which would require an asymmetrical load through the pelvis. You can imagine one leg is on the ground providing support. Nothing is supporting the other side of the pelvis. This requires a significant amount of muscle force and pelvic stability in order to prevent pain or shearing, since we know that those ligaments are already very flexible through the pelvis and the hips. So some examples of some two-footed tasks would be things like a squat, a split lunge, which would be having one foot forward and one foot backward, but both legs remain on the ground and coming down into a lunge and back up. But you'll notice I'm not doing a lunge where I step forward, because that would require a one-legged task into two. So I'm going to place my feet, drop down, and come back up so I can safely provide support to both sides of my pelvis. A deadlift or a suitcase lift is a nice way to start to practice safe lifting technique. I do typically recommend that people get some skilled guidance when performing this safely to minimize any kind of strain on the back. Typically, we'll start a hip girdle pelvic floor training program about 5 to 6 weeks postpartum. Usually people will wait the 6 weeks until they've had their postpartum visit with their GYN or OB, and then we can start these types of programs. But some gentle squats, some gentle split lunges, if you feel that you've had a non-complicated delivery and are not having any pain issues, can be very safe to perform prior to that 6-week appointment. But I would just really dial down the intensity and frequency that you're performing those so that you can assess how your body feels after you do those. So typically, something like a squat, because it is so functional, it's very much like getting off the toilet or sitting into a chair. You're probably doing more squats each day than you even already think about. So adding in a couple little squats and seeing how your body tolerates that is a nice way to start to build that pelvic stability. Once you feel that you're able to perform those tasks safely with good form and at a higher repetition and frequency, then we can progress to a one-legged task. These would be things like a single leg squat where maybe one leg is elevated or you're on one leg. It could be lunge walking like I showed previously. It could be something as advanced as a single leg deadlift, or maybe doing some different step aerobic style or step style training. You can imagine, because of the asymmetry through the pelvis, this requires a significant amount of hip strength and pelvic stability. And maybe you're thinking, well, geez, I did that before the baby, so why can't I get back to it? You may be able to, but if you progress too quickly back to these tasks, it can cause significant pain at both those SI joints that I showed, as well as your spine, or even at the pubic symphysis, or right there in the front part of your pelvis. So we want to make sure that we really proceed cautiously, which is why I highlighted that this is a very individualized process. Once you're able to perform one-legged tasks successfully and with good pelvic alignment and hip strength, that's when we typically will progress to things like plyometrics, jumping, or running. So plyometrics is just a fancy word for jumping tasks or dynamic tasks. This could be things like jumping for an exercise program or a video, or something like running, which is essentially like progressing one-legged jumping after another. I really, really strongly encourage my postpartum moms to avoid dashing back into running too quickly, because the risk for injury is very high given the amount of relaxin in the system, especially if you're nursing, as well as the amount of trauma that's occurred at the pelvic floor and hip girdle already. So I really encourage my postpartum moms to consult with a pelvic PT and make sure that your pelvic floor is strong enough and has the right endurance, and that your hip and pelvic stability is such that we don't see any alignment issues or any risk factors. Because if we start too soon, your potential for long-term problems, whether they're pain-related or incontinence-related, is going to rise. Now, keep in mind, there are many women out there that can return back to running quickly after childbirth. And by quickly, I mean usually around 12 weeks is the earliest that I would recommend having someone dive back, unless you are a very elite runner. But, most people will transition into this after a couple months of strengthening and pelvic stability. And I again echo the sentiment of avoiding diving back into this too quickly at the risk of very long-term problems that will last throughout the remainder, or potentially last throughout the remainder of your life if unaddressed. So my key for this is to start slow. If you are going to dive into running, you should be able to have good single leg stability as well as a good Kegel contraction that's strong and long. And you're going to want to start with little bitty trials of maybe a little tiny jog with mostly walking, and see how your body responds. Do you feel any pain? Do you have any urine leakage? Do you feel any bulging in your vagina? These would be signs that your body is not ready yet to translate into running. So starting slow, trying with a little bit of walk, run modification, and then really carefully assessing how your body responds. Because again, if we start too soon, we'll really overstretch that pelvic floor and cause long-term issues. All right, so I've highlighted a couple of these already, but things to keep in mind with running: strong Kegel contraction with good holds, and very good hip and pelvic control. So I really recommend the pelvic floor specialist just to do a quick check. Sometimes it can be just one visit to go in and say, like, okay, where do you see my deficits? What can I work on? If we start too early, the risk for long-term problems is very high, as well as the risk for potential pain or injury. We talked about the run-walk intervals, but make sure that you're able to keep that pelvic stability and abdominal stability throughout the running. You're going to gradually build your mileage and then gradually start things like interval training or sprinting. The best quote that I've ever heard from any pelvic health specialist is from Brianna Battles, and she said, hey, peeing your pants is the same as having bad form. And I thought that was really brilliant. If you are losing urine during exercise because of leakage, that's your sign that your pelvic floor is not tolerating that task. It's the same thing as if you had horrible exercise form. It's really showing you that your muscles aren't supporting your body like it should, and that you're not really ready to be at that intensity level. We've got to build the foundation, or your pelvic floor, to allow your body to be more successful. Okay, let's transition out of exercise and go into some lifting recommendations. Certainly, you're a new mom, you're a new dad, because this part can apply to everybody. You're lifting this load all day long, and maybe it seems like a little tiny, cute, little smelly load, but it's there, and you're lifting constantly all day long, whether it's getting the baby out of the crib, putting them in and out of the car seat, lifting the carrier, lifting them off the floor so they can play on the play mat or have tummy time. There's a lot of different activities that can strain the back and strain the neck when you're particularly not at your optimal physical form. So we've talked about the relaxin, which is making you more flexible. We've talked about the strength loss in the pelvic floor and abdominal muscles, which are so critical for spine health. And we've talked about this repetition of doing this so frequently. So we see all these risk factors are elevated that could potentially cause problems down the line. So a couple tips to think about when lifting. You're going to always want to position yourself as close to the baby as possible. So the two times that I see this becoming most problematic is if you have a crib that has a very high rail and you're reaching over to get that baby. So you can imagine if this is my crib and there's a high rail, I have to really, really reach over, and now the baby is too far away from me. In that situation, I would definitely recommend elevating the mattress height as best you can given the age of your baby and their functional level, or potentially using a very long, wide step that will allow you to get closer and higher to the baby. The second time where I see this being very problematic is the car seat. So most new parents, when they have one child, they put the car seat right in the middle of the car. This can be really hard to get that carrier in and out of because you're really reaching in across the first seat to get to that second seat. When doing that, what I recommend is getting used to the practice of setting the carrier onto the closest seat, then repositioning your feet so you can get closer, and then lifting into the cradle. Certainly for those of you that have multiple children, you have the opportunity to bring that car seat now to the first seat position, which will eliminate a lot of that excessive bending and reaching. When you're performing that lifting, the tips that I typically will give in this order are: create tension in your abdomen. So we're going to think about turning those hip points in to give our spine some stability. Take your shoulder blades, tuck them into your back pocket. And what that does is, you'll imagine if I was slouched without my shoulder blades, I have a lot of strain that can potentially occur through my mid-back. If I take my shoulder blades and tuck them into my back pocket, that essentially turns on all the muscles of my back. So I turn on my front, I turn on my back, and then I stick my rear end out to bend. So it looks like this: on, rear end, back. So it may look a little bit regimented, but by doing this, I'm able to use my large rear end muscles, some of us larger than others, to lift that baby to wherever it is it needs to be. Now, if the baby's down on the floor, I still can do that same sequence. Front turns on, back turns on, I bend, and now I can reach down to get the baby. Or maybe I do it in kneeling to start, which would look like this. I come down next to the baby, I'm in kneeling, I build my abdomen, I build my shoulder blades, I lift, and now from here, come into that standing position. So a lot of different options here. Same thing when doing the car seat. When I'm loading that carrier in and out of the car, oftentimes if I have to reach to the middle seat, I'll take one foot and step it fully inside the car so both legs are planted, turn on my abs, turn on my shoulders, and then use my legs to help generate that lift over into the center seat. So that combination, that trifecta of abs, shoulder blades, and rear end out helps to prevent any kind of back strain because it optimizes all of the muscles. Like I mentioned earlier, the other big complaint I get is nursing moms are like, oh gosh, my neck is killing me all the time. All I'm doing is looking down, or all I'm doing is holding the baby in front of me, nursing. And certainly we all know postpartum that the nursing regimen is not only emotionally draining, it's very time consuming, and it's very, very frequent. So a couple tips for improving your nursing or feeding if you're doing bottle feeding safety. First thing is, you're gonna wanna prop that baby up on a pillow. So using things like the little bobby pillow or even just a little throw pillow under your arm is gonna help bring the baby up to your breast, as well as improve your ability to hold your neck neutral as you're making eye contact or whatever it is, feeding the baby, whatever the case is. So have that propped, because it's going to reduce the tendency to want to slouch over top of the baby. It's going to definitely reduce strain in the arms as well as the neck. If you find that you're doing a lot of your nursing in a very soft surface, or a lot of your feeding on a very soft surface, like a really comfortable couch or cushy couch, take a pillow and stick it behind you. So one of the things you want to avoid is that tendency to slouch way back into that super puffy chair, super puffy couch, because now you've just further bent the spine and shoulders into a bad position. So, if you're a smaller mom and you're on a really deep couch, or if it's a very squishy material, take a little pillow, put it behind your back so that even as you lean into that super squashy material, it gives you a little bit of support to prevent that spine rounding. Certainly alternate sides. Now for nursing moms, this is obviously going to be a necessity because you have to nurse on both sides for the breast. But if you're a bottle feeding mom, just try to alternate which side you're propping the baby in. I know for me, I'm always a left-hand baby carrier. I like my hand here, my right hand free to do whatever I need to do. And most moms will develop a preference. But I really encourage new moms to alternate sides, whatever you're doing, whether it's feeding, whether it's carrying, whether it's playing on certain sides where you're always sitting on one side. Make sure that you're alternating the sides of your body. Carrying the carrier, I know I always love to have my carrier under my left arm, but really force yourself to carry the carrier on both sides, because as we build these patterns of one-sided dominance, it leads to other issues down the road. So I really encourage my new moms, whatever you're doing, make sure you're doing it on both sides. And then lastly, after feeding, do some stretching. So you can imagine, here I am feeding my baby, whether I'm breastfeeding or bottle feeding. I'm kind of bent over, I'm looking, I'm checking my phone, whatever it is I'm doing. I'm in that forward position. So the best way I can combat that is by now going into an extended position, just like the woman here in the picture. So you can either grab hands and stretch. Sometimes I'll put my hand on a doorway and lean forward. But really the idea is you want to open up all across that front part of the chest and neck to help overcome that sensation of always being in that flexed position. So I really encourage new moms, really stretch, open up, and let your chest expand after you do your nursing or feeding regimen to allow those muscles to stay flexible, as well as to help build some strength in your shoulder blades. All right, so in summary, wow, that was a whole hour. That's amazing how fast that goes. Pregnancy and childbirth, I mean, we know it disrupts your entire body. It disrupts, your mental life, your physical life, everything about it. And really where we see this predominantly affected is in the pelvic floor, the abdomen, and then the hip girdle. So we know that this is going to have some significant effects on how we can return to our normal tasks. It is certainly safe to start exercise, particularly pelvic floor stability via Kegel or abdominal training immediately after childbirth with some guidance, as well as early return to two-footed hip and pelvic girdle strengthening tasks so that you can safely start to build that connection and re-stabilize this body that's feeling so much instability. Safe lifting habits and safe feeding habits are going to help to reduce your potential for pain. And really, my key message here is you're not alone. It can be very overwhelming, particularly as a new mom. And I really can't even say that because even as a mom of multiple children, each time you have a child, it offers a new challenge. So whether it's a physical challenge, an emotional challenge, a mental challenge, the key of surviving motherhood is recognizing that you're not alone. There's people available to help. So when you have someone to guide you through the physical aspects of it, it makes recovering from childbirth significantly more manageable. Whether it's you come to me for pelvic health guidance or you seek another pelvic health therapist, I don't care. I just want to make sure that everyone has access to the information they need for a safe return. Because not only does it help improve your physical ability, but by having an improved physical ability, it will certainly help your mental ability and your ego and feeling better about yourself as you transition through this very difficult stage of life. So certainly reach out to someone that can provide you with assistance, whether it's through email, through a free consult, through an appointment, whatever the case is, and talk to your OB about wanting to see a pelvic health specialist that they can recommend someone that they work with. We are here to help. I am here as a resource. I'm available via email at kwilson@reachyours.com, as well as through social media. You're welcome to sign up for a free consultation on our website. We can figure out whatever works for you. We're currently doing telehealth appointments. This has been utilized even prior to COVID for a lot of my new moms that can't get out of the house because they have a newborn. So that's definitely an option. Or you're welcome to come in because God knows getting out of the house is grand when you have kids. So any way, shape, or form that it looks to you, we're here to help, whether that's through questions, appointments, whatever the case may be. Certainly, I appreciate everyone coming out today and attending this lecture. As a thank you, please visit reachyours.com/pelvic, and you can download my top recommendations for the 5 pelvic floor exercise for early recovery postpartum. Some of these exercises, even if you're not just postpartum, these are going to be great for pelvic and hip stability training. So I recommend these exercises to most of my patients, regardless of if they are postpartum or not. So my gift to you, please download and enjoy, and certainly reach out with any questions if you have them regarding that exercise program. So with that, I thank you very much for joining me today. I am here for you as a resource, and I wish you the best of luck in your postpartum recovery, whether it's been 2 days or 20 years. Best of luck to you.